Hi, this is Dr. Kim, and just wanted to thank you for all of your membership and asking questions and sharing your experience. And I also want to give a shout out to Tori, who is a fantastic moderator, and really appreciate her leadership and sharing her knowledge about running groups as well as LDN. So, a little bit about myself. I'm Dr. Kim. I'm a functional medicine, integrative medicine physician with expertise in LDN. And I learned about LDN not from my training with Dr. Andrew Weil, which was fantastic, not from any official sources, but from patients. And it's made a huge difference with my patients. In originally, I used it for autoimmune almost exclusively, and then I used it for chronic pain, especially neuropathy. And then now, as I understand better about how LDN works, I use LDN also for neuroprotective reasons, and that's very relevant to what we're going to talk about. As you may recall, there was a poll, and there was the most number of people requesting a lecture on LDN and chronic fatigue syndrome. So, chronic fatigue syndrome, let's start with what it is. Chronic fatigue syndrome um, is a fatigue that is lasting up to 6 months. It's post exertional malaise, unrefreshing sleep, cognitive function, or brain fog, and you can have pain. And for that reason, it's also known as myalgic encephalomyelitis, and that says that a combination of brain fog and almost like fibromyalgia or headache, pain related symptoms. And in functional medicine, we look at this condition as a multifactorial condition, including is there immune dysregulation, is there a hidden infection, is there mitochondrial dysfunction, gut imbalances, hormonal abnormalities, environmental triggers. And then we can have, in functional medicine, one of the advantages is comprehensive assessment, personalized treatment plans, and systems biology approach. So that's something that conventional medicine, I think, is currently lacking. Functional medicine strategies may include, as I said, is there root causes, and there are supplements that are used, such as coenzyme Q10, carnitine, D-ribose, magnesium, nutritional, um, anti-inflammatory diet, and to avoid mitochondrial toxins such as heavy metals, pesticides, and mold, immune dysregulation. And if you think about it, this is where LDN is super helpful. And gut health and dysbiosis, that's a whole different topic by itself, but that's one. And then hormone imbalance, same thing, whole different topic. Environmental toxin, again, whole different topic. And nutrient deficiencies and whatnot. So the things that and there's a blog that goes along with it. I would like you to check that out. And the thing that I want to really focus on is the role of LDN. How is LDN relevant to treating chronic fatigue syndrome? So we've discussed that myalgic, meaning that there's muscle pain, joint pain, or headaches. So LDN is fantastic for reducing inflammation, and if you reduce inflammation, usually you make pain better. And the other part about that is that if you make um, if you say that chronic fatigue syndrome, and I agree, is an issue with brain function, then it makes perfect sense because in LDN, one of the things that LDN does is it's an excellent neuroprotector. It's also excellent at reducing neural inflammation as well as regular inflammation as well as immune regulation. So if you believe that chronic fatigue syndrome has those components and LDN is not end all be all, will take care of everything, but it is something that I think can play a very important role in being basis. So in my practice, I find methylene blue to be an excellent tool to refresh or to support mitochondria. And I've seen excellent results with that. And in my practice, in real life, I also have been trained in a field known as acupuncture neurology, and that has been a great tool to help patients with brain fog. And for profound fatigue, there is a protocol that I've learned from a 104-year-old Korean acupuncture master that refreshes the vital essence and amazing results with chronic fatigue as well as profound fatigue for other reasons, including uh, um, chemotherapy and cancer. So this is Dr. Kim, and thank you. And if you found this video helpful, please give me a like and consider subscribing and sharing. Thank you.